Hi, welcome to the Health Corner on the Breakfast Show on Kamne TV. I am Dr. Nakbianam Fire. This week we are talking about diabetes, and yesterday we talked about how diabetes can be managed and how it's diagnosed in the hospital. So we say that diabetes, when you have diabetes, you need to be tested at the hospital on more than one occasion to be able to ascertain for sure that you have diabetes. And once you have been diagnosed with diabetes, diabetes can be treated but not cured. So you'll be given some medications that you have to take at home, and you have to take them continuously without stopping. Also, you need to be able to eat right. So you will not only be taking your medication, but also eating the right diet. So you need to be able to work with a dietitian who will be able to guide you on what you eat and what not to eat and how to eat. So the other thing that we mentioned yesterday was that you need to be active to be able to sensitize your muscles to take up glucose from your body. So today we're going to talk about some of the complications of diabetes. Diabetes has so many complications. Some of them are acute and some are more on the chronic side. So some would happen instantly, others would take a long period of time for them to happen. So some of the acute complications would be things like diabetic ketoacidosis. And this is a condition where your body has got so much ketones, you feel sick basically. You have symptoms of being very weak, and you become dehydrated. So this condition is mostly managed in the hospital, and you'll be given some medication for it. So the other complications happen over time. They happen on a longer period of time, and they usually affect the blood vessels. So your blood vessels become affected, and it can affect both the large blood vessels and the smaller blood vessels. So when the smaller blood vessels are affected, some organs become affected, and these include the eyes. So you have eye problems, and sometimes people with diabetes might end up becoming blind. So it's important that you control your blood sugar to be able to prevent some of these complications. The other complication is that your kidneys become affected. And when your kidneys are affected, you end up having high blood pressure, you end up having other complications of swelling in the legs and the feet, and you can even have chronic kidney disease and the complications that come with chronic kidney disease. So that is when the smaller blood vessels are affected. So what happens then when the larger blood vessels are affected? Some organs in the body also become affected, like your heart, for example. You end up having heart disease, you can have heart attack because of uncontrolled blood sugar and on a long period of time, for a long period of time. So other organs affected include the brain. You can have a stroke because of uncontrolled blood sugar that has affected your blood vessels in the brain. You can also have peripheral artery disease, and this is a disease that causes a problem in your arteries, especially in your legs. And so when that happens, it means there isn't enough blood circulating to your legs, and so you end up having complications of having foot diseases and having sores in their feet that are not healing because of insufficient blood going to those areas. So you end up having diseases, or you end up having sores basically in your feet, and this can even lead to you having an amputation, because if the ulcer or the sore is not healing in the foot, then it will have to be removed from the body. So these are some of the complications that come about because of diabetes. The other complication, major complication that diabetic patients would have is that they have neuropathy. So the nerves in the body become affected. And sometimes they might present as feelings of needle pricks in the legs, because the nerves in the legs are damaged, or even any other part of the body, can be affected as well. And we'll discuss tomorrow how you can prevent yourself from having diabetes. Yeah. So today we have talked about the complications of diabetes, that diabetes can affect so many organs in the body, including the major organs, including the heart, the brain, the kidneys. It can affect the eyes as well, and your nerves. So be sure to take care of yourself. If you are diabetic, make sure you're taking your medication, make sure you're checking your blood sugar every day, and make sure that you are eating the right types of food to prevent yourself from having these complications. Thank you so much for watching, and I'll see you tomorrow again.